everyone. Greetings, everybody. I'm Priyanjali from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to studies conducted across four Indian cities, reveal that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot in melasma. Indian skin tone is more susceptible to pigmentary disorders that occur mainly in women, which is 90%, and 10% of all male ethnic. Right. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustration, setback in treatment. To avoid all these hassles and to keep you informed today, we are here to know about the management of melasma from expert. So let's connect today with our skin expert, Dr. Chanchal Chaudhary from Noida. Dr. Chanchal Chaudhary is a seasoned expert with over 17 years of experience in medical dermatology, dermatological surgery, cosmetic dermatology, and hair transplantation. Dr. Chaudhary obtained her post graduation from Dr. D.Y. Patil Medical College, Pune, and honored her skills during senior residency at P.N. Behl Skin Institute. Her proficiency spanned a wide array of advanced treatments, including fractional CO2 lasers, diode lasers, IPL, Q swatched, and lasers, Botox, fillers, thread lift, radio frequency, body contouring, chemical peels, microdermabrasion, derma rollers, chirotherapy, mesotherapy, fractal lasers. Currently, she's practicing as a dermatologist and cosmetologist at La Femix Derma Clinic. Dr. Chaudhary is dedicated to enhancing skin health and aesthetic through personalized care and cutting edge treatment. With her expertise today, Doctor will enlighten us more on melasma and its management. Over to you, Doctor. We are extremely delighted to have you here with us today. The first question, doctor, for you would be, what is melasma?
Yeah, thank you for that elaborating about my introduction. That's really good. Nice. um, so about melasma, as you was already told in your introduction at the starting, that it is a pigmentation which is not seen in both men and women. Okay, but when a patient comes to me, I usually see a blotchy brown pigmentation, which is an acquired skin pigmentation. Okay, so it's blotchy, it's like patches are there, and it is bilateral. It is present on both the side of the cheeks. Second, it is acquired. It's not from since birth. So it is acquired skin disorder. And when I see this type of pigmentation on a patient face, we call it melasma. Okay, so melasma itself means a brown pigmentation. Fine. And
Right.
it is sometimes also called as a mask of pregnancy. It's very well known as a mask of pregnancy or cholasma because it's quite visible in females during pregnancy.
Right.
Hello.
Doctor, as you have already mentioned, it's an acquired condition. So, apart
Yes.
from pregnancy, what can be the other causes of melasma?
Yes. So before going exactly to the causes, the etiology of the melasma is very complex. Okay.
Right.
And it has been seen, it is photo aging being acquired. It is photo aging. What does a photo aging means? Induced by UV rays. Okay. That's why
Right.
it's more of an acquired condition. So it is photo aging condition. In a genetically prone individual, they are more prone to get the melasma. Okay, so this is basically the complex etiology of the melasma. Is to just make it little simplified, is that we all know we have a melanin which gives the color to the skin. Okay, and how this melanin is formed is from the melanocyte cells. Now these melanocyte cells are there at particular part of the skin which is known as dermal epidermal junction, which is nothing but the deeper part of the skin. Now,
Hmm.
when these melanocytes, which produces melanin, it becomes overactive. It starts producing more melanin than what is required for a skin color. And that gives a
Right.
brown pigmentation, brown pigmentation. Now, if it
Right.
is a brown pigmentation towards your upper layer of the skin, which is known as towards the dead skin of your skin, it gives a brown pigmentation. But sometimes, we have a different layer of the skin, and this pigmentation, it goes little down. Instead of coming to the dead skin, it goes deeper to the deeper skin, and it gives a dark brown to grayish bluish discoloration, which we know as dermal pigmentation. Okay, so depending on how much overactiveness of the melanocyte is there, and the melanin is deposited whether in the upper skin layer or it's going deeper, it gives brownish to grayish black discoloration on the patient face or wherever the more pigmentation is there. So this is
Right.
basically the cause is the excessive production of the melanin.
Right, right. Well, very beautifully explained, doctor. Now that we know what can be the cause behind it, the main issue with any sort of condition or any sort of disease is identifying the disease. So,
Yes,
how does the initial stage look like? As we know that it can be brownish in color or grayish in color,
grayish
can
color,
start from a
yes,
little small patch, but it's quite similar to freckles. So, how do
yes.
people not confuse it with freckles, and how does the initial stage look like when the person should actually go and visit the doctor? So, which is the perfect time the person should go and visit the doctor?
So basically, as I mentioned, it is a blotchy pigmentation. When I say blotchy, in freckles, we have discrete pigmentation. Whereas
Mm,
in melasma, the pigmentation is like it forming a certain, circle, small circles and they are like white in between. Then there's a little pigmentation, there's a whiteness in between. That type of pigmentation comes. Whereas in freckles, it's a discrete pigmentation. Alag alag. First point. Second, in melasma, there is a particular distribution which we'll see. It's most common on the face, which is melasma is visible, and it start visible mainly on the centrofacial area. When I say centro, forehead, nose, and cheeks. Okay, this is the common area where you will see. The other common area is the malar area where we see on the only on the cheeks and upper lip. It's quite commonly seen nose, cheeks and the upper lip. Sometimes there is a lot of sun exposure and patients start developing around the jawline. Okay, around the jawline also, and it can spread to your neck area. Okay, and sometimes extra facial also, like on your arms, shoulder, and in the upper back also. So these are the particular sites where we usually see these patches, which are blotchy patches. And to start with, they are small, but gradually, they can become into a larger area as well. So these are the different area where melasma is usually seen, and with the different distributions.
right, right. Apart from that, doctor, is there any itching which includes or any pain which includes with melasma?
So basically, there is no itching as such. Okay, there is no
Mm,
pain. Only what can we see is a little redness. Okay, there can be a redness associated with the melasma, and the redness can be aggravated by the sun exposure. But as such, there is no basically pain or itching symptom which is there in melasma.
so, are there any risk factors included as well?
Yes, so there are many triggering factors I can say. So the basic main important is the UV radiation, the sun exposure. Okay, so
Mm,
you have to protect your skin from sun exposure. The main cause why the melanin is why the melanocyte is overactive in generating a excessive melanin is the sun exposure. So this is the
mm,
main cause for melasma development. Second, which is most commonly seen in women, is the hormonal imbalance. Okay, which can be in the form of changes in the like pregnancy or postmenopausal. If you have the PCOS, then it is more commonly seen in the females. Also, if you have a thyroid imbalance, then you're more prone to develop the melasma. Third common is stress. So sometimes stress induce the level of cortisol. So that is, if it is induced by cortisol, it can induce the melasma pigment or a melanin pigmentation. Or also seen with some medication. If you're taking some medication like retinoids, which makes your skin a little more photosensitivity, or some antibiotics, and sometimes anti-seizures medications can induce the melasma pigmentation. And we should not forget the lifestyle. Now, if our lifestyle is not good, we are smoking, we are not taking any antioxidant, we don't have any particular regimen to follow, then a lot of oxidant will be produced that can lead to the production of the melanin. So these are the major things which I think can lead to melasma, and I'm forgetting about cosmetic as well. So sometimes if you're putting a lot of cosmetic and that's not of a good brand, then it can induce the phototoxic reaction leading to excessive melanin pigmentation. So these are the risk factors, or I should say the triggering factors, which can induce the melasma in a patient.
Right, right. Doctor, for the people who has a genetic predominance, they have somebody in their family who
Yes,
are suffering from
yes,
melasma. So what
mm,
can be the prevention strategies for those people? Also, is it contagious? Can it
yes.
spread through one person to other?
Yeah, that's a very good question. Of course, it's not at all contagious, okay, because it's not an
Hmm.
infection. But yes,
Hmm.
if it is there in a family, genetic prevalence is being seen in around, if there's anyone family in the family of a melasma, then you have a chance of some 50% to 60% to get the melasma if you're not taking care of the triggering factors. So family inheritance is there, but it's not contagious.
Right. So, what preventions can they take in order to, protect
Yes.
themselves from having melasma at an early age?
Yes, yes, definitely. So, as I said, first and foremost, you have to put a sunscreen because the main cause is the sun exposure, okay, radiations. Now, not only that, when you're going out, then only you're putting a sunscreen, okay. Even sometimes the patient they come, doctor, it's a cloudy as we are seeing these days, so there's no sun. Why should I put a sunscreen? But if you are genetically prone, then you have to apply this sunscreen even if the weather is cloudy or it's winters or summers. So weather does not matter. Second, if you're indoor and you're exposed to more of the LED screens these days, then also you have to put the sunscreen. So it's a must to put a sunscreen, especially in a person who is genetically prone to get melasma. Second, you should have a lot of good balanced diet because that is where you can have a lot of antioxidants and prevent the formation of excessive melanin. Third, if you have any hormonal imbalance, if you think, then you should speak to a dermatologist or endocrinologist, so that at a very early stage you can take care of the hormonal imbalance and prevent the formation of the melasma. So these are the triggering. So you have to look for the triggering factors. You should work on it so that you should not develop the melasma in future. So that is there. And of course, if you develop during pregnancy, we sometimes gives multivitamin. There is a deficiency of multivitamins like iron or B12, and there are many patients they regress their melasma once they develop during pregnancy. Post pregnancy, most of them if they're taking a proper vitamins, they the melasma definitely fades away, or in most of the time it goes away, and in some patient if it remains, it lightens up to a very great extent. So these are the things which you have to keep in mind if you are prone to develop the melasma.
Right, right. Well, doctor, for the patients suffering from melasma, we have just known from you that sun exposure is something which they should protect themselves from. So sunscreen is a must. But
Yes.
is only sunscreen enough? Do they also need to cover their skin when they are moving out of their homes?
Yes, so definitely sunscreen is a must, but yes, they do have to cover their like they have to put a wide brim hat if it is too much of a heat outside. Definitely, they need to it. They have to wear a full sleeve t-shirts. You have to cover the
Hmm.
whole arms as well. So all the exposed areas has to be covered, even if you are putting a sunscreen when you're going out. That's a correct one. We should
Right,
definitely.
right, right. Doctor, speaking about sunscreen, it's a task to choose a sunscreen for our skin. We still
Yes.
do not know what sunscreen we should choose. So if you could
Yes.
help us with that as well. Which sunscreen would be perfect for patients, for people suffering from melasma?
So when I prescribed any sunscreen to a patient, I give two, three things in my mind. First, the skin type, whether the patient has a dry skin type, the oily, or a combination. Accordingly, I choose the component, whether gel based or a matte finish or a cream based is there. Okay.
Hmm.
Second comes the role of the SPF. Now, a sun protection factor. So usually if you have a pigmentation tendency, then I usually give sun protection 50 plus and above, because that much protection you definitely need, because 50 and above gives the protection of around 99%. Okay. And also the amount of application of a sunscreen is also important, how much you have to apply. So we should apply at least at least half a fingertip of the sunscreen, where the patient is not able, sometimes they don't do it that much of a liberal application because of the stickiness or something. That's why we choose the sunscreen which suits to your skin type. Okay. And second and third important part is that when we are putting the sunscreen, it should be a wide, broad spectrum sunscreen. It should cover the chemical sunscreen, physical sunscreen. Nowadays, there's a combination of sunscreens which are available, so that the sun protection to be at the maximum level is there. Right. So the combination sunscreen, then PA factor 3 plus. And so these are the factors which I usually keep in mind when prescribing a sunscreen to a patient. So it's always better, instead of buying an OTC, sunscreen, do visit a dermatologist. You should know which
Right.
sunscreen you should apply, and then start applying a sunscreen.
Absolutely. This is what we always suggest our viewers, that please, please, self-medication is the worst thing you are doing to yourself first. Visiting the chemist is the second worst thing you're doing to yourself. So please,
Yes,
please trust the expert. Uh, अपने आप से अपने शरीर को ना जांचें. There are people dedicated to do those work. Let them do their work. और आप अपना काम कीजिए. Trust your expert, trust your dermatologist. And I'm sure जितने भी लोग suffer कर रहे हैं अभी worried है, all your problems are going to be resolved. Doctor, speaking about melasma, as such, is there any life threat from the condition?
no, it's not. It's definitely not, and it's a pretty benign condition. So there's no threat, no contact. No, it's not contagious. It's just the overactiveness of the melanocytes, which leads to melanin pigmentation because of the different treatment factors. There's nothing to really be scared of melasma. Only thing you
Right.
have to be take a preventive measures. That's important.
Right. Right, right. Well, this would bring a sign of relief for all our viewers today. But of course, because it covers the facial area, women
Yes.
especially, we are very much
Yeah.
conscious. It also, somehow
Hmm.
hampers the psychological health of a patient. Patient, they seems to be depressing, distressing all the time, just because whatever the condition is affecting the face. So how do they make themselves stable, and how can they accept the fact, and also what thing can bring a sign of relief for those patients who are suffering from melasma, who thinks that ye to kabhi cure nahi hone wala hai, this is always going to stay with me. uh, what can
Yes.
be the best possible advice for them?
So this is a myth that it cannot be cured. Let me tell you. Definitely, it's melasma is a stubborn pigmentation. The word stubborn is
Hmm.
there. So if it is a
Right.
stubborn pigmentation, there are treatment for it. Okay, to a great extent. So every patient is, and in melasma, as I said, is genetically prone, and every patient has different way of pattern of presenting with melasma. If it is at a very early stage, as I said, if it is superficial, there are likely chances that it can fade completely. Okay. And also, if you take a precautions and all prevention, then the recurrence chance is also very less. If it is deeper pigmentation, as we tell about, or a mixed pigmentation, where the epidermal, dermal, both are involved, in that, even we can lighten it to a great extent with a number of therapies. And then you have to just follow the all like sunscreen application and all the cream which a doctor will prescribe you. And definitely, it will be much lighter than what it's supposed to be, like not to be treated. It can be lightened to a great extent. Okay, you have to just follow these steps. And application, everyone apply the moisturizer, the sunscreen every day, and we wash our face. So why not to apply a cream which maintain your pigmentation and boost your confidence? So that's the only difference I feel, that you have to keep in mind, then when you are putting any cream on your face, especially when you have a melasma. So it's nothing that you cannot treat. You can actually cure at a very early stage, and you can maintain it to your lifetime.
Right, doctor. Speaking about recurrency, we see a lot of people once they see changes in their skin and they see their skin healing, they stop
Yeah.
taking the medication. So, how harmful
Yes.
can that be? How frequent is that case? And how frequent is the recurrency in melasma?
So I have seen a recurrence case only when the patient is not able to follow the prescription properly. Or
Mm,
second, if there is a major hormonal imbalance is happening. Okay. So sun protection is a must, and a must. I should say this. If this you are putting your sunscreen religiously daily, then recurrence chances goes almost 50% down. Okay, first point. Second comes the daily care application, so that you have to follow. And some even in clinic treatment we do for the patient, that you do as a regular treatment. Okay, and if you do those treatments, the recurrent chances goes really low. Okay, so I have seen recurrence, but I have educate my patient how to prevent the recurrences, and they do follow the all prescription, and recurrence really goes too low. So that is we have to keep in mind.
right, right. Well, we are talking about sunscreen here. There is a word in the market that people, the companies, they are just making the sunscreen hype so that they can sell it, make some money out of it. But
Yeah.
the dermatologist would not do that because she's not earning anything from it. So please, please, all the people, we are talking about melasma today, but generally, people, please use the sunscreen religiously. That's all you have to do for your skin. Use your sunscreen. Time has changed. Weather condition is changing. Our skin needs the sunscreen. We have to protect our skin from the sun rays nowadays. And also, doctor, for the people who are a little out of the topic, of course, for the
Yes.
people who are conscious about their health, also they think that sun rays is important. Which time would be the perfect time to have the sun rays?
Yes. So this controversy has come that if you're putting a sunscreen, then you might develop
Mm,
vitamin D deficiency. But the
mm,
thing is, if you're exposing your skin to a sun rays, I should say around 7 to 8 early in the morning or late
mm.
evening. It varies from season to season. Okay, little bit, but early morning 7 to 8 or late evening maybe around 5 or 6. Okay, so and 10 minutes of exposure, okay, is sufficient to build vitamin D, right?
Right.
So, and then after 10 or 11 until 4, the sun rays are not good for our skin. Okay, so they can lead to
Mm,
pigmentation, mole generation, and sometimes skin cancer. So it's basically 10 to 15 minutes sun exposure early morning or late evening is the best to have vitamin D formation.
right. Now let's talk about the diagnosis, doctor. How do we diagnose melasma, and what are the treatments currently available for melasma?
So diagnosis is quite easy. So now you see the patient. Clinically, we can see and that pigmentation is melasma. But sometimes we do Woods lab examination in which epidermal pigmentation it increases, whereas the dermal pigmentation remains the same in Wood lab examination. And the add-on, diagnosis we do with dermoscopy these days, where we can visualize the depth of the pigmentation also. Okay, so after taking the histories and proper examination, we diagnose it as a melasma, whether it's a facial melasma or extrafacial melasma, and then we go with the therapy. If, as I said, there are many types of melasma, whether it's an epidermal or a dermal or a mixed melasma. I usually start with priming the skin. Now, what is priming the skin? Priming the skin, we always give some home care treatment to the patient initially, okay, so that the skin able to reduce the overactiveness of that melanocytes and melanin production goes down. Okay, also the patient see the response that the melasma is lightening up. Okay, so this is known as priming, or starting with a cream therapy of a patient. Also we analyze the any vitamin deficiencies are there. We write down some blood tests for the patient. We counsel for the lifestyle modification. Any hormonal imbalance is there, then we have to evaluate for that and have to work for the hormonal imbalance also. And simultaneously, after 3 to 4 weeks, I call my patient and I suggest some treatments like chemical exfoliation, which helps in exfoliating the upper skin pigmentation. And if and I usually add on some micro needling. Now, what does a micro needling do? It forms a micro channels and helps in faster healing of the skin and maintaining the activity of the melanocytes. So that helps in repairing your skin faster. And if I really need a help of a laser, then at last I do add laser, and there are different type of lasers available, which help in targeting the deeper pigmentation and giving a better and a good result to a patient. So this way, I would with this hierarchy that I decide on the cause and the treatment to the patient.
Right. Doctor, can chemical peels be actually helpful for the melasma patients with stubborn marks?
Yes. Yes, stubborn marks definitely, because the as I said, it helps in exfoliating your upper pigmentation. Okay, so we have different type of chemical peels. One is you exfoliate a lot for a few days, whereas and the other peels are for maintenance. So we do chemical peel helps a lot depending on what type of pigmentation you have. I decide on the chemical exfoliation, and patient will see the results.
Right, right. Doctor, like speaking about the general people, initially the women, suppose our mothers, they kind of gave up on their skin by now. So I see a lot of women who at this age, they are like, what's the point of changing our skin? What's the point of working on our skin anymore? So they also kind of give up कि अभी तो ये ठीक नहीं हो सकता है. So
Right.
what can be the best possible advice for them? Can they also be cured for the women who are in their 50s, in their 60s? Can
Yes.
treatments or proper medication cure their condition?
Yes, definitely. मैंने जैसे बोला, एज इज नॉट अ बार. ओके, एंड डेफिनेटली अगर आपको पिगमेंटेशन है एंड हम जो आपको ट्रीटमेंट कर रहे हैं लाइक केमिकल एक्सफोलिएशन, एंड देयर आर लॉट मेनी ट्रीटमेंट, इट्स नॉट जस्ट द केमिकल एक्सफोलिएशन इज द ट्रीटमेंट. I keep adding other and other new medicines, also the treatment, as I said. Then a very popular one is a vampire facial, if I'll tell you, in which we utilize the growth factors from the platelets and we reduce the pigmentation. So age is not a bar. At any age, you can start the treatment. Sooner you will start the treatment, better will be the result. More you wait, now I don't think so it will go. It is so stubborn. I've taken so much of a treatment, but is recurring again and again. Then it's not a solution. You have to come discuss it with a dermatologist, and they will provide you the different solution which we have now, in our platform. There are number of lasers, there are number of peels, there are number of new therapies which are coming up, and that will help in maintaining your skin. And what you have to do is the prevention factor which you have to follow at home. So you definitely need to treat your treatment and be look confident and lighten up your pigmentation.
Right. Doctor, there are also some myths which are related to melasma. We have heard people saying that melasma can cause cancer. Is it true?
Yes.
And what are the other
No,
myths
no.
which you have heard?
Definitely it's not cancerous. It's not allergy. Okay, sometimes patient doctor, I have done this, I have an allergy, I'm developing pigmentation. So the
Mm,
pigmentation is of many kind. It's not of just the melasma. There are multiple causes of hyperpigmentation, and melasma is one of that one of the clinical appearance of the hyperpigmentation. Okay, so definitely it's not cancerous. And since you asked for the different myth, the patient which comes to me is first and foremost, if any male patient comes to me, they say, doctor, why I have developed this pigmentation? Because usually, it has been seen more common in women. So is it really seen in men? So then I have to explain them that if you have a more of outdoor activity, if you have some genetic prevalence, then even men can develop it. Okay, and if you have thyroid imbalance, so one of the factors they come with a gender bias that I've mostly seen in females. How come it's now in males? So it can develop in males, but yes, it's more common in females. Second is when patient comes to me, they say, doctor, whenever I go out, I put sunscreen. So as they say you should put sunscreen, and still my melasma is still there. I'm developing a melasma. So I have to tell them that if you're going out and still you're developing, then you have to put your sunscreen. a sunscreen even when you are indoor. It's not meant to be put only when you're going out. Okay, so you have to put the sunscreen religiously, daily, whether you're indoor or outdoor. Even if you're not in front of a screen long time, we have these light, visible lights, which can make you prone to develop the genetically prone patient or hormonal imbalance patient to develop the melasma. Then third, which patient comes to me that, I've already developed the melasma, doctor. Now, what the sunscreen will do that, why should I put sunscreen now? Because this is not going to help me. So I tell them, no, you have to put a sunscreen. Doesn't mean that you were putting and still you're developing a melasma, that you stop putting the sunscreen. If when you stop putting the sunscreen, your melasma will aggravate further. Okay. So to maintain it and reduce it, you have to put your sunscreen regular. So there are many queries related to sunscreen when the patient comes to me. And yes, as you said previously, then patient comes, do you really have any permanent solution for melasma? Do you think I should go for the treatment? So then I have to tell them, no, see, there's nothing called permanent. It's like, is it a treatable condition or not? So if you're able to treat it, that means you can go for the treatment and you can maintain your pigmentation. So don't think that there is no solution for it. So why should I go and spend on treatment? It will not. It become worsen. It will spread to your other part of your face. It will spread to your arms and neck. So you have to with the treatment you have to lighten up, and so that it should not spread further. And then sometimes they come back, why you are doing peeling? Can we go directly to the laser? I think I heard that a lot of lasers which are available now, which can treat melasma. So I tell my patient, yes, there are lasers which are there, but we don't step, all together onto the laser treatment, because we have to start with a basic treatment first, and that works. That's wonders. If not, then I'll take definitely help of the laser, and will provide you the treatment for the melasma. So these are the myths which, and the queries, I should say, which the patient comes to me and I have to deal with them.
Right, right. Well, doctor, any dietary precautions, any do's and don'ts for patients suffering from melasma?
Definitely. Definitely. As I said, a main and major component, if you have vitamin D deficiency, if you have vitamin B12 deficiency and iron deficiency, very commonly seen in women, there are chances that you can develop the melasma or pigmentation on your face. So dietary, definitely we have to look for that. Also have a green leafy vegetables and nuts in your diet. And look for, because antioxidants are very important. Okay, even vitamin C, oral intake of vitamin C, I tell my patient to take. So multivitamins, and of course some sort of exercise is also important, especially when there are
Mm,
metabolic syndrome associated,
mm,
like PCOS is there. Then I ask the patient to have some sort of outdoor activity as well, like exercise, I mean to say, in that. And so these are the things which you have to keep in mind. And smoking, alcohol, that also you have to, that also aggravate your pigmentation formation because of the formation of reactive oxygen species. Okay, so these are the things which you have to keep in your mind when you have a pigmentation tendency.
right. So, doctor, the deficiency which you have mentioned, vitamin D, B12, iron.
I
So,
know.
what do you normally suggest your patients? The the vitamin should be taken from food source, or do we normally suggest the medicines for the same?
So I do check their levels. I test for
Mm,
the if there is a particular deficiency is there. So if I find a
mm,
deficiency, I add multivitamin. If not, then I ask them to improve further with the diet. So I'll counsel them for the diet. But if deficiency
mm.
is there that will not be taken care so early with the diet, then I add on the multivitamins.
Right. So, those medicines, can those be harmful? Do they have any side effects?
No, no, no. Multivitamin is what I said to Bex. We give it, we keep evaluating the evaluations of the blood level. When we see that
Right,
we have covered the deficiency, then we take it as a maintenance if required after 3 months again. I just repeat
right.
the course. Or I ask them to take a better diet. This is that.
Right,
So there
right.
is no harmful
So
effects.
let's talk about the same thing. So we see a lot of patients whenever there are such deficiencies, we also see changes in the skin, hair. We see a lot of hair falling, maybe because of
Yes.
deficiency in vitamins. So
Yes.
we see patients that they have visited the doctor before, and they have taken the medication which the doctor has prescribed, and after a
Yes.
certain period of time, maybe 4 months, 6 months, they have started developing the same thing again. In that case, they think कि डॉक्टर ने तो दवाई हमें प्रेस्क्राइब किया है ऑलरेडी, वही दवाई हमें फिर से ले लेना है बिना डॉक्टर को दिखाए. Can that be same, that can that be safe for the patients, or that can have an adverse
No.
effect?
That can have an adverse effect, yeah, because especially the vitamin D, if it is you have a sufficient vitamin D and you're taking it further again, so that can
Mm,
accumulate in a body. Okay, because it's not a water soluble vitamin, it's a lipid soluble vitamin.
mm,
So that can be harmful to your body, even with vitamin A.
right,
Yes, B12 and C do are water soluble vitamins, but excessive, anything excessive will going to harm your body. Okay, so
right.
it's not advisable. You should get, if you're developing again the pigmentation, you have completed your course, you should visit your doctor, you know take an advice and then only start multivitamins.
Right. And especially what we always suggest our viewers is that go for a routine checkup every 6 months,
Yes.
every 1 year. You
Yes.
should check your body, whatever things are happening internally. We don't know. We can just see
Yes.
the external changes in
And
our body, but
yes,
internal thing we have no idea about. So a routine checkup is a must. Moving ahead,
exactly.
Doctor, are over the counter medications also harmful? Can they also cause melasma? Also, we see a lot of women, they are very much used to taking contraceptive pills right now, oral
Yes.
contraceptive
Yes.
pills, as we can say. Can
Exactly.
that also
Exactly.
cause melasma?
Yes, yes. Oral contraceptive pills can induce melasma because it is the reason for why melasma is there, because of the estrogen and progesterone changes. Okay.
Mm,
So, yes, OC pill can induce melasma if a patient is taking the OC pills. So, then we can work with the gynecologist and we can look for the alternative if we can. If, OC pills is generating a melasma to a patient. So that is there. I think
apart
there's
from that,
another
any
question.
other over the counter medications that can
Over
also
the
trigger
counter.
melasma?
Yes, 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 definitely. I said that if you're putting any cosmetic and if you're
Mm,
not aware of the ingredients, it can lead to phototoxic reaction. Okay, what is a phototoxic reaction? Is it's you're making your skin photosensitive, and even
mm,
if you are exposed to the sun to a normal, then you start developing your pigmentation after the application of that cream. So this is known as phototoxic reaction, developing a melanin pigmentation. Not only this, sometimes patient comes with the redness, rashes, acne, pigmentation, facial hair. So these are the complications which I usually see when a patient apply they started developing pigmentation, they visit the over the counter and they start applying the cream, and they the pigmentation worsens. Not only this, they start developing acne, facial hairs, and lot of redness. So this should not be done. We should, whenever you see the pigmentation is start appearing, you should consult a dermatologist.
right. We are talking about application of products here. Doctor, we see a lot of cosmetic products nowadays in the market. There are
Yes,
a vast range of cosmetic products. Also, women are very, very much into acquiring that
yeah,
glass skin, which they see in Korean
yes,
women. There are Korean products, and
yes,
our Indian skin is absolutely different. Also, genes play a very important role, which we are not able to understand. We think that आजकल स्किन फेयरनेस के लिए बहुत सारे प्रोडक्ट्स मार्केट में है,
right,
ग्लूटाथायोन एंड
right,
what
right.
not are there in the market. So
Hmm,
we normally used to take those with the
hmm,
doctor's or dermatologist prescription in case if we want some changes in our body. But
yes,
nowadays we ourselves have started treating ourselves. All those
yes.
retinoids, peptides, whatever products we have in market, can those be safe for normally everybody, all the females, or males, or for the patients suffering from melasma? Do we suggest them those, or do we have a total different skincare regime for them?
So for melasma, it's a total different skincare regime. because
Mm,
when we have uneven skin tone, okay, at first point of time you can read that niacinamide gives the or mild retinol or kojic acid. Patient come with
mm,
this, doctor, I'm already applying kojic acid, I'm already applying niacinamide for pigmentation, but still it's not going. So what best? So I have to and tell them that this is not the ingredient we're just looking for. There are many more ingredients which need to be applied, and which also include this. Okay, the concentration, the other ingredients. You have already only read the kojic acid and niacinamide or vitamin C serum or hyaluronic acid added to it, and they start
yes.
applying. Okay, so I think these are the major things which patient comes to me that we are already applying this, and retinol. They don't know the concentration. They don't know the which type of retinol it is. So sometimes the patient, they start applying. They have pigmentation. Don't retinol works on pigmentation, and they start applying it for months. 1 and 2 months, and anti-aging as well. And suddenly they see that their skin is red. They whenever they go out, their skin become too rosy red again, and skin is
Mm, mm,
exfoliating also. And then there was a doctor,
mm.
I have started developing this dryness on my face, and though my skin is oily now, it's I don't know how come it's more dryness is there. So then I have to educate the patient that the retinol which you have applied, the concentration you don't know, and the application, the way you should apply those serums. So there's a different things. It's not just buying and applying it, the way of application, the sun protection, how much concentration, how to maintain it with the other ingredients. So those, if you meet a dermatologist, they can guide you much better than applying buying a serum and then start applying for the pigmentation.
Right. Well, this, I believe this normally happens because of the social media influence, uh, because
Yes,
of the because of the vast social media influence. Also, we
far,
are so much keen towards knowing the celebrity lifestyle, the kind of products they
exactly,
use. Nowadays,
true.
everybody has a YouTube channel and everybody shows their
Yes.
skincare regime. And we think that
Mhm.
only because the person is applying those products, I need to do the same. But
Okay.
we have to understand they apply makeup on a daily basis. They have a total different skin. Their diet is totally different from us. We cannot follow those diet. We
For that,
cannot
right.
follow those
Yes.
lifestyle which they are
Fine.
following. So
Follow.
everything as a whole is different. They are a total different person altogether, and we are
Right.
different. We have a total different routine. We have been brought up in a different way. We are in a different weather, so everything plays a very important role
Major
when
role.
we are talking about skin, when we are talking about health. It's just you cannot imitate somebody else, you cannot be somebody else. Just love yourself the way you are, and that's the best thing you can do to yourself, loving yourself. With that, I can see few of the questions coming up from the viewers now, doctor.
Okay.
The first question comes from Pooja
Yes.
Sharma, who asks, can
Hmm.
LED screens worsen melasma?
Of course, the LED screens, the blue light we talk about. So that worsen melasma, it has been studied and proved. That's why I always say when you are in front of a screen, do put the sunscreen. So, sometimes the patient comes, doctor, I'm so in front of a screen even in the evening and night. So I have to put the sunscreen even at night or evening. Then I have to say, if you're working in the evening, and now the working hours are different. Some people are working, in the evening hours, or they're working hours in the evening and late night. So then you have to put a sunscreen if your workings are in the evening. Okay. Yes.
Right.
So if you are in front of a screen, LED sunscreen do aggravate the melasma, especially if you are having a pigmentation.
Right. Pooja, I believe you have got your answer. The next question comes from Meenal Verma, who asks, how does melasma differ in men and women?
So it doesn't differ in men and women. Okay. And the blotchy pigmentation both are visible. The trigger factors are same. Only thing is in women, the hormonal changes aggravate the pigmentation. Okay. That's the only thing is, otherwise the sun exposure, the medication, thyroid, stress, lifestyle changes, these all factors triggers the melasma in men and women, and the presentation is also the same.
Right. And the last question, doctor, comes from Akansha Puri, who asks, what role does genetics play in melasma?
So, as I said, yes, it has been seen that in a genetically prone patient, if in a family, if someone has the melasma, then you have a more 50% chances to develop the melasma, or the 50% chance that your melanocyte can be overactive with the triggering factor and have a tendency to develop the excessive melanin. So that's why it has a genetic role. So not in all patient, it's but in 50 to 60% of patient, family inheritance has been seen with the overproduction of the melanin.
Right,
Okay.
right. Also, doctor, the final question is can melasma be cured completely or it can be controlled?
So yes, it can be controlled to a great extent, and you are
Hmm.
there at a very early stage. When you start noticing that the pigmentation is there, do visit a dermatologist. We can definitely even cure. Okay,
Right.
but most important is we can control if we follow the regimen. Then it can be controlled and been very light. Okay,
Hmm.
so that you have to keep in mind.
Well, all you have to do is follow your skin regularly, love
Yes.
yourself. If any changes occur in your body or your skin, you know what to do. You have to visit your expert. Before we take a leave, doctor, today, any take home message for our viewers who has watched us so far?
Yes, the take home message is that don't be afraid of pigmentation. Okay. So, one or two dots are there to everyone. But if you are having a far more pigmentation, just follow the regimen, have a good lifestyle, and put a lot and lot of sunscreen. Okay. Make sunscreen as your friend, and then mm, follow your lifestyle. So, that's what I just wanted to say.
Right. With that, that was Dr. Chanchal for us. Thank you so much, Doctor, for your valuable time. It has been a very, very informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more updates on skin, health, and care, stay connected to our page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you. Thanks a lot.